Mass media, aka the internet and social media, has done a lot of good for our society, but it has also created a culture of younger adults who are self-diagnosing medical issues and in turn are possibly misdiagnosing healthcare issues. The internet is vast and can be a source of quality health information that people can use in determining how to progress with seeking healthcare. But as more and more young adults are without insurance or don't have access to quality healthcare, the internet and social media has replaced traditional routes, and this can create problems with people misdiagnosing, people overdiagnosing, or people forming cyberchondria. This problem relates to the social determinants of health, and it states access to mass media and emergency technologies. So this is like cell phones, the internet, and social media. While mass media and technology has done great things for healthcare, it is important for people to understand how to use it when seeking health information. To try and combat misdiagnosing, overdiagnosing, and cyberchondria in young adults using media to get their healthcare, it's important that people have valuable and credible resources to utilize. So let's go through some of the resources that people can use when they are looking for health information. So the first resource is using credible, user-friendly health sites. So these are websites such as the National Institute of Health, the Centers for Disease Control, the World Health Organization, the American Diabetes Association, the American Heart Association, and so many more. You do have to be careful in choosing what site you are researching information from, as this can lead to misdiagnosing easily if you're not using a credible source like Google or Wikipedia. To check the source's credibility, you can check the source's authority, accuracy, objectivity, currency, and coverage. Another resource for people who are seeking health information on the internet would be to use virtual health assessments and doctor's appointments, or telehealth and telemedicine. So many clinics and doctors are doing virtual health visits with their patients, and especially as COVID-19 has occurred, this trend has been on the rise. It is important, though, that you're finding a credible physician or clinic and not just going to anyone. Many appointments can be covered by insurance, and this form of virtual appointment allows patients to talk with their doctor and allows doctors to write prescriptions for the patients in the convenience of their own home. Another resource for people would be open forums and discussion boards. So these are websites like Reddit, Quora, and Open Group. They allow for open conversation for people with questions or topics. These websites are open for anyone to reply, so their credibility is decreased, but it can still be informative and a reassuring way to gain health information. Some healthcare specific websites are Doctor's Lounge, Health24, eHealth, Patient.info, MedHelp, and MDTalks. These forms can also lead to misdiagnosing, though, and potentially be harmful for a patient. So it's important for the user to understand that they still need to see a doctor if they're having a medical issue. Another resource for people are websites and apps that are for reviewing goods and services. So these are specific for reviewing doctors, health clinics, and hospitals, and they come from actual patients. They can be informative, and they can help patients make decisions regarding their health care. Healthgrades, Doctor.com, Wellness.com, RateMDs, Vitals, Google My Business, Yelp, and Facebook are all websites that can help people find reviews and subjective information on doctors and healthcare systems. These websites can lose their credibility as well, as many of these reviews are subjective and opinionated, so it's important for the user to understand this and to use their own judgment. Okay. Another resource for people who are seeking health information can be social media, blogging, or blogging. So apps like Twitter, YouTube, Instagram, and Facebook can allow for a community of people who have a similar health issue, such as diabetes, to bounce information off of each other. They provide support to each other and understanding of the disease. Social media can be a source of information for people with a health issue, but again, credibility is an important factor to consider. Videos and images from sites such as YouTube and Instagram can provide knowledge and instructions on a particular health topic and be a good source. Again, though, the person must understand that these sites do not replace doctors and they should still receive health care if needed. Okay, so actions for the future. So in the future, young adults need to do their part to ensure that when they're searching information on the internet, that they're using credible websites and they're understanding that what they read on the internet cannot be a diagnosis and that they still need to seek medical or health care for health issues. The public cannot be all to blame for misdiagnosing, though. Websites can spread biased, harmful information without needing checks and balances to what they're putting out to the public. Health information websites and social medias need to have some sort of regulation so that misinformation is not and cannot be spread. Mass media definitely has its benefits. It allows people to have health information at their fingertips, to schedule appointments, and to meet with their physicians virtually, and it lets them be informed on changing health and medical news. But it also has its challenges, and they cannot be ignored. There has already been major progress in this area, but it is important that we don't stop until the problem of people misdiagnosing, overdiagnosing, and/or forming cyberchondria has been eliminated. Thank you.